What's good, YouTube? Hey, Jay, and I'd like to welcome you back to Respiratory Therapy Essentials for the TMC exam. Now, tonight we are talking about non-invasive ventilation or BiPAP. And I can't stress to you enough how important this subject is because you must know the ins and the outs when it comes to NIV and BiPAP. It is the one thing that can save your patient from going on full mechanical ventilation. Are you ready to go? Let's do this. Okay, guys, our lesson tonight is non-invasive ventilation or non-invasive positive pressure ventilation, or in short, we call it BiPAP. Now, NIV is a form of mechanical ventilation with unique features. I say unique because it's done by mask. There is no ET tube. You don't need a respiratory rate, and the patient is responsible for initiating the breath. The information that you see in front of you will appear on the TMC exam, without a doubt. You must know the ins and outs about BiPAP and NIV, okay? This therapy is used for patients with COPD to avoid mechanical ventilation. It's also used while sedation is being weaned. The patient is being weaned off sedation. Okay. It's also used when the patient has been given diuretic due to difficulty in breathing, to give the diuretic, time to pull off that fluid or time to work. Now, a lot of patients will come into the emergency room complaining of difficulty in breathing, but all of them will not end up on BiPAP. However, those patients with fluid overload or bronchial constriction, such as congestive heart failure patient and pulmonary edema patient who is impending failing, we put them on BiPAP or NIV to prevent them from going on mechanical ventilation. And you must know this for the exam, okay? Because NIV decreases the work of breathing. One of the main purpose of it is that it's used to blow off CO2 before ventilatory failure occurs or before the patient pH drop below 7.25. Because you do note that we intubate once that pH drops to 7.20, we have to intubate them, okay? NIV is used for DNR and DNI status, okay? People that don't want to be resuscitated or don't want to be intubated, we use NIV because we don't have to use the ET tube for this therapy. Now, Roman number 2 in the middle of the board, NIV is also used because it is the best option to prevent mechanical ventilation. I say that again because you will see this on the TMC exam, okay? If the patient cannot protect his or her airway, then you must intubate them and place them on mechanical ventilation, all right? Now, when we talk about BiPAP, let's talk about the key settings. And the main setting that you have to worry about is the IPAP, the EPAP, and the FiO2. IPAP standing for inspiratory positive airway pressure, EPAP, expiratory positive airway pressure, and then the FiO2. All right. The IPAP controls the CO2 to help blow off CO2. The EPAP controls oxygenation, okay, which is our FiO2. Now, some machines have O2 analyzers built in, but on this exam, you may have to bleed in 2 or 3 liters of oxygen from a flow meter. If you are put in that situation on the exam, always get an ABG. Get a blood gas to titrate that oxygen down, okay? They'll challenge you on the exam. Now, when it comes to initial setting for the BiPAP, here's what you need to know. Your IPAP setting should be set between 10 and 12 centimeters of water. The EPAP should be set between 4 and 6 centimeters of water. And FiO2 should be as low as possible, as long as you can maintain a good sat of 90 or greater, 90% or greater. Okay? That's why you need to get that ABG unless that analyzer is built in. Before placing a patient on full mechanical ventilation, I cannot say this enough. You must check and read those questions well, because the NBRC will bait you. They will make the case look like it's time for mechanical ventilation when you simply should put them on BiPAP. Okay? So make sure you know all the ins and outs. All right? NIV will also decrease the chance of ventilator-associated pneumonia. No ET tube, right? Okay? It avoids the use of the ET tube. And anytime that you have that ET tube, there's always a risk for infection. When we are weaning a patient, we can place them on NIV, even if they are not fully ready to be liberated. An example, COPD patient. You will not change the damage already done to their lung, but we still have to get them off that ventilator. And NIV or BiPAP is a great way to help wean them off of the mechanical ventilation. All right. Now, I know you have study guides and study books or seminar book, but you need to practice making changes to the settings on the BiPAP machine, because the IPAP controls the CO2 and EPAP controls oxygenation. Okay? But you need to be able to see these settings so that you can make sure that you are setting the BiPAP correctly to achieve your goal. Okay? And there you have it. Okay, guys, and there you have it. Listen, non-invasive ventilation or BiPAP or non-invasive positive pressure ventilation is tested heavily on this test. Know the ins and outs, know when and know the how. And I ask you to take these tips on this board into consideration, because you will see them again on the TMC exam. Hey guys, listen, I really am trying to get you a subscription in order to stay on YouTube making videos just like this in bite size, that you may pass the TMC exam on your very next attempt. If you would, hit that like button, subscribe to my channel, turn on the post notification bell, because I am putting out videos every single week concerning respiratory therapy essentials for the TMC exam. And until next time, we out.